central government is planning to create a chat GPT-like application to help doctors boost their accuracy of diagnosis and their productivity. Developed using the latest techniques in artificial intelligence and machine learning, the plan is being worked upon under Ayushman Bharat Digital Mission, where doctors across India will start creating digital prescriptions instead of handwritten linking health records. In February, Apollo Hospitals rolled out a similar model, which uses a clinical intelligence engine using AI and ML, which can analyze extensive volumes of data to aid healthcare professionals in identifying patterns in reports and symptoms of patients. For instance, as doctor would start feeding the symptoms and case history of patient in the application will start throwing its own estimates and suggestions. If patient is having a terrible cough, for example, from last 1 month, the application would prompt and suggest to the doctor the possible ways to go ahead with the diagnosis, such as suggesting the list of laboratory or diagnostic tests required in the first step. The government is planning to use the data from Apollo Hospitals, All India Institute of Medical Sciences, New Delhi, and Tata Memorial Hospital, Mumbai in the initial attempt. Once the digital health mission kicks out across India in full strength, the AI-run tool will collect and learn from enormous data itself. Thank you for watching the video.
Wiser started with my own struggle with mental health. As I was struggling, I began to realize how even people like me who are very privileged have so many access barriers to mental health and how bad the situation could be for everybody else. And once you see the issue, it's very hard to unsee it. We started out with trying to create an AI interface that could use natural language processing and be able to be a place where people could talk about their issues without worrying about being seen by anybody else, but still feeling heard. We began to realize that it's reaching so many people who otherwise have no access to mental health, and it's really helping them. A majority of Wiser users tend to be in working age populations or younger, so generally between 18 to 25 or 25 to 40. That's also contiguous with the use of the internet, and these are people who are likely to seek help using the internet or get these resources through their employers, etc.
Hi, I'm Christian. I'm one of the co-founders of Consensus. Consensus is an AI search engine for research papers. You can think of it like Google Scholar meets ChatGPT. Let me show you an example. Let's say I'm interested in the question, can CBT improve anxiety? Consensus will instantly help you find the best research papers related to your question, will synthesize insights across the literature, and will help you extract important pieces of information related to your research workflow, such as answers directly from papers, the study design, the population the research was done on, the sample size, and much more. Everything you care about going through the literature, Consensus speeds up with AI. I can even chat with the papers by using our Copilot toggle here. Let's say I want Consensus to draft me a lit review on this topic. Consensus will run the search again and then respond with an outline of a lit review with the citations in line. From finding the right papers, to extracting important information from those papers, to synthesizing it all together and kicking off a writing task, Consensus speeds up your research workflow with AI. Sign up to start searching for free.